Welcome to this edition of the First Aid Show. The rules in the healthcare setting for newborn CPR is different from standard infant CPR. What we'll cover in this edition is only for healthcare professionals and not for standard first aid. We've looked at infant CPR, but there's a younger group we need to briefly mention, which is the CPR advice for newborns for healthcare professionals, as this is different from standard infant CPR. This guidance is just for healthcare professionals and not for standard first aiders. Newborn life support is complex. In this video, we're just going to look at the basic guidelines. Healthy babies have good tone, they have colour, a good healthy heart rate, which within a few minutes of birth will be between 120 and 150 beats per minute. Less healthy babies are blue at birth, less good tone, and a slow heart rate of less than 100 beats per minute. A seriously ill baby will be born pale, its body will be floppy, it will not be breathing, and will have a slow or undetectable heart rate. Firstly, you need to keep babies warm and dry. Place them on their back with the head in a neutral position. Next, assess tone, breathing, heart rate, and record the data. If after 30 seconds there is no reaching or just gasping, get help and consider oxygen level monitoring. Open the airway and give 5 inflation breaths, then reassess the heart rate. If there's no chest movement, reopen the airway and repeat the breaths. If possible, consider 2-person airway control. If no increase in heart rate, the heart rate is absent or less than 60 beats per minute, start chest compressions, 3 to each breath. Make sure you assess the baby's vital signs every 30 seconds throughout the resuscitation process. You also need to consider venous access for drugs, and if an oximetry is available, increase the oxygen levels where necessary. Finally, update the parents and debrief the team.